Be a part of this very, very special occasion for Southeast Kansas. At this time, it's my pleasure to welcome to the podium Freeman Health System's President and Chief Executive Officer, Paula Baker.
Thank you, Kevin. You know, I have a reputation for whenever we have a groundbreaking that we have a weather extreme. I'm famous for that. So I think today what I bring is the wind. So we're gonna deal with that. So I really do appreciate that all of you are joining us this morning for this very special event as we break ground for our new Southeast Kansas Hospital. This day truly marks a historical event, not only for Freeman Health System, but also the entire Southeast Kansas region. So you're going to see soon construction crews are going to begin transforming this 55-acre soybean field into Freeman's newest full-service hospital. Located just minutes from downtown Pittsburgh, our new 50-bed hospital will cover 170,000 square feet. Freeman's investment in this project is conservatively $168 million. Additionally, we expect the hospital to create 500 to 1,000 new jobs in the Pittsburg and Frontenac area. So that's going to be a very big boost for the company. Thank you. So as I look out over the group today, I see a number of individuals who have been integrally involved in this project since we first began visualizing and planning it. So I want to thank you for your continued involvement and passion as we bring our dream to a reality. And I know that most of you here today live in Southeast Kansas, and you have personally experienced the impact that Freeman Health System has on your hometowns. And you are very important to Freeman. So that is why we have made significant investments in your communities to ensure you have access to the highest quality healthcare available. Many of you have already entrusted your care to Freeman, and we're honored to serve as your healthcare provider. Everything that we have built over the last decade in Southeast Kansas has truly been with you and your needs in mind. I'm so proud that we already have a robust presence in Pittsburgh with several primary care clinics, an outpatient surgery center, a freestanding MRI, a comprehensive medical oncology program, a specialty clinic with over a dozen physicians represented, a physical rehab center, and more. So we also currently are very proud that we have clinics right here in Frontenac. And all of these services have been established so that residents of Southeast Kansas have access to the medical care that they so richly deserve, all that it will contain. So we will be providing comprehensive care, and it will include acute care, an emergency department, a cath lab with cardiac services, an intensive care unit, maternity services, pediatrics, outpatient and inpatient surgeries, robust robotic procedures. I put rocks in my pocket. Did you guys? Okay, good. GI procedures, oncology, pulmonology, sports medicine and orthopedics, radiology and laboratory, also behavioral health and medical education opportunities. So you can see that's the whole array of services. The construction process will take place over approximately 24 months in 3 simultaneous phases. The first phase, site development, utilities, and roadways. And you see a lot of evidence of that today when you look over the fields. Second phase will be construction of an ambulatory surgery center, and on the second floor we'll have a medical office building for our physicians. And then the third part is the construction of the main hospital structure. But keep in mind these will be done simultaneously, so you'll see many things coming together at once. So today's groundbreaking is a prelude to the site development, and Freeman engineers are working with the city of Frontenac and the engineers to design and upgrade sewer and water infrastructure to serve the hospital and the future of the community. And the city actually began planning for water and sewer upgrades several years before we even selected this site. So what foresight, Mayor and John, that's amazing. And that timing couldn't be better because we start construction as they start construction of a new water tower with new pumps and piping, and that's going to be needed. So I want to express our appreciation to Frontenac City Manager John Zafuda and Mayor Steve Morrison for your support and assistance. You have been steadfast in that. Let's give them a hand. And also, I would be remiss not to especially thank Danny Kaler. Where's Danny? There he is, our Director of Facilities, who's done so much. Thank you, Danny. So Freeman is right now coordinating with the Kansas Department of Transportation, and they recently conducted a traffic study which projects the impact of increased traffic at this site. And Freeman will work very closely with KDOT to ensure that any improvements necessary for traffic safety are studied and addressed. We have our architects in attendance today too, HMN Architects of Overland Park, and they are designing the hospital as well as the other components on the site. And so I want to express appreciation to the principal architect, Dave Brown, and senior architect, Jennifer Cash, who are leading the way. Thank you. So I guess in closing, I would just say that we at Freeman firmly believe that the residents of Southeast Kansas deserve the very, very best. And at Freeman Health System, we're committed to providing just that. So thank you for sharing in this historical and monumental day. And now I'm going to turn it back over to Kevin because I think we're going to get ready to do some shoveling. All right, Kevin.
Thank you, Paula. Now for the fun part, guys. I would like to invite Paula and our special dignitaries to make their way over to the shovels and the hard hats behind me for the official groundbreaking ceremony. Thank you for joining us for this special occasion and ceremony this morning. At this time, Paula is available for individual or group interviews, and refreshments are waiting on this table. And please help yourself. And thank you for coming out today. Thank you.